The COVID-19 pandemic has exposed persistent and deep racial inequalities in the United States and around the globe. In the United States, Black people and other racial minorities are infected, hospitalized, and dying at faster rates than white people. African American people have a rate of hospitalization for COVID-19 approximately 5 times that of white people and are dying at double the rate of white Americans. Hispanic and Latino people have a rate of hospitalization approximately 4 times that of white people. But why is this the case? The answer is not due to biological factors, as people of color and white people are made up of the same genes, yet people of color experience a much more severe effect. This chart depicts the unequal hospitalization rate between Black, Hispanic, and white individuals. The rate of hospitalization for Blacks is higher than it should be when taking into consideration their share of the population. Black people in this country only make up 18% of the population, yet they are experiencing 33% of the hospitalizations. This chart further emphasizes the disparate impact of COVID-19 as it portrays the unequal death rate between members of the African American community, the Latino and Hispanic community, and the white community. Black people are dying from COVID-19 at a much more rapid rate, indicated by the orange bar. Hispanic and Latino people are dying at a faster rate as well, represented by the gray bar. So why is COVID-19 having such a disproportionate impact on minority groups in this country? It is a result of long-standing systemic inequities that have caused many members of racial minorities to be at a greater risk of contracting COVID-19. Health differences among racial groups stems from inequities present in living, working, health, and social conditions that have persisted over many generations of history. Structural discrimination has limited equal access to healthcare for people of color, and that is the overarching source of this problem. The 3 predominant factors that contribute to this disproportionate effect of COVID-19 are disparities in living conditions, work circumstances, and health circumstances. Living conditions can contribute to health and make it harder to follow the required steps to prevent getting sick from COVID-19. Many members of racial minorities are more likely to be living in densely populated areas and more likely to be homeless due to institutional racism present in the residential housing system. Living in densely populated areas makes it harder to follow the guidelines of social distancing. In addition, many members of racial minorities live in neighborhoods farther from grocery stores and medical facilities, making it harder to get the necessary supplies they need to stay safe. Minorities rely more heavily on public transportation, making it challenging to maintain social distancing and increasing their exposure to the virus. Multi-generational and multi-family households are more common among racial minorities, making it harder to protect older family members if space in their home is limited. Lastly, because of inequities in our criminal justice system, racial minorities are overrepresented in jails, prisons, and detention centers, making it difficult to slow the spread of COVID-19. Certain work policies can put workers at an increased risk of getting COVID-19. Many racial minorities are more likely to work in the following conditions. 1, as essential workers. The risk of contracting COVID-19 in professions related to essential industries such as healthcare, meatpacking plants, grocery stores, factories, and service industries such as restaurants and retail is much greater. These workers are required to be at job sites despite outbreaks and often have to continue working due to economic reasons. Their disproportionate representation in frontline jobs increases their exposure to COVID-19. 2, not having sick leave. Workers without paid sick leave are more likely to continue working when they are sick, increasing the transmission of the virus. 3, income, education, and joblessness. On average, racial minorities earn less than white people, have less accumulated wealth, have higher rates of joblessness, all factors that emphasize their need to work and their increasing likelihood of getting or spreading the virus. People of color are at an increased risk for contracting COVID-19 than white people due to higher known rates of underlying health conditions such as diabetes, asthma, hypertension, and obesity. These chronic diseases make for worse and more fatal cases because individuals with chronic disease states have compromised immune systems and are more susceptible to infection. Many racial and ethnic minorities are more likely to be uninsured, which presents an issue in accessing COVID-19 testing and seeking adequate care. Many minorities may refrain from going in to receive care due to distrust in the healthcare system, language barriers, and the toll of missing work. So does this trend hold true in other countries? This pandemic has exposed the blatant inequalities between racial groups within countries all throughout the world. For example, in England and Wales, the death rate for Black, Pakistani, and Bangladeshi people is nearly double that of white people. In the state of Sao Paulo in Brazil, People of color are 62% more likely to die from COVID-19 than white people are. Additionally, higher mortality rates of COVID-19 have been observed in the Seine-Saint-Denis department, an area in the northeast of Paris that is home to many minority groups. This chart represents the predicted death rate for various minorities in the United Kingdom based on their representation in the population versus the reality. It is clear that for each of these racial minorities, their death rates are significantly higher than they should be. Meanwhile, the death rate for white British individuals falls below nearly all of these minority groups. Evidently, we see how the disproportionate effect of COVID-19 on racial minorities holds true throughout the whole world, not just the United States. So how can we move forward? Considering this pandemic's disparate toll on minority groups, the public health response should be directed on allocating necessary resources, such as wage support, food, temporary housing, protective equipment, etc., to the communities that are suffering. Testing needs to be directed towards the areas that need it the most. Healthcare providers, healthcare institutions, healthcare insurance providers, employers, and government and elected officials must work together to guarantee that minority groups are given more opportunities to access quality medical care. They must receive equal access to routine healthcare, health screening, immunization, and health education to eliminate health disparities and their increased susceptibility to COVID-19. Ultimately, policies that address racial inequities in our society that this pandemic has exposed is what we need to create sustainable change.